Hi, good evening, everyone. Good evening, everyone. How are we all doing? Let's join in. Good evening, everyone. How are we all doing today? Oh, please put on your camera. Put on your camera. Please put on your camera. I want to see your faces. Put on your camera, everyone. I want to see your faces. Welcome, Ma. Welcome, Ma Oyade. Welcome. I'm seeing Toluwalope Ogunjimi. You are welcome. You are welcome. You are welcome. You're welcome. Okay, Matoluwalope Ogunjimi. Welcome, Ma. Welcome, Ma. Ma.
Good evening, everybody. Please, can we hear me? Am I audible? I think there's something up with Deborah's network. Good evening, good evening, good evening, Dr. Tolu. Good evening, Mrs. Hafsat. Good evening, everybody. Okay, thank you for the response. So today we're having a webinar and our topic is holistic medicine. But before we go into the topic of the day proper, would like to just meet ourselves. Let's introduce ourselves. You can drop your comments in the chat section. You can drop your comments in the chat section, your name, what you do, just a brief introduction about yourself. I think Deborah is back. Deborah, let me know if you can hear me. So just like to have your name and what you do. Please, you can go ahead. Nobody should be shy here. You can go ahead, your name and what you do. Okay, Deborah, are you back? Can you hear me?
Yes, I can hear you, ma. I'm here,
Okay,
ma.
so you can go
I'm
ahead
back.
with.
Sorry for the break in transmission. Okay. So I would love to know our names. We'll have to unmute our mics now. I'd love to know our names and what we do.
Okay, so you can go ahead.
So I'll be, so I'll be starting with Stella Otonu. Stella Otonu, are you there? Stella Otonu, are you there? Okay. Oh, okay. What do you do, ma? Yes. Okay. Salau.
Okay, I think our network is gone again. So I've not heard anything from Stella. Stella, is it that you're not here? And then Mrs. Hafsat, can you hear us? Please would love you to introduce yourself. And I'm seeing Peace Shofayo. Would love you to introduce yourself. Let's just briefly know you before we go on. Okay, why is everybody quiet? Okay, Peace is, oh, thank you, Jesus. Peace is finally talking. Okay, hi, Peace. Good evening. Welcome. Stella, we're glad you're here. Please introduce yourself. Please let's fill up the chat section. We want to know that you're here. Please don't be quiet. This is not the this is not a place to be quiet. Treasure is also here. So let's just introduce ourselves in the comment section. I'll be reading the section to see our introductions. Mrs. Salau says she's a nurse. Wow, welcome, ma. Welcome, welcome, welcome. So this is Mrs. Salau Hafsat Alake. She's a nurse. Stella is here, but Stella, we can't hear you and we can't see your introduction. Oh, Peace Showfire says she's a medical student. Welcome, Peace. Welcome, our doctor to be. And we also have Dr. Toluwalope Ogunjimi. She's also here. We celebrate you. Thank you, everyone. So as we go ahead, we are going to be having a survey. I'm going to be sharing the survey with us. This survey is just to help us know the baseline idea that we have about this particular topic. So I'm sending it right now to the chat section. Would really love you to fill the survey. It will only take like 2 to 3 minutes of your time. It wouldn't take time at all, just like 2 to 3 minutes. It's a brief survey. It's a brief survey. Please let's look through. Let me see if we have anybody on YouTube. Okay. So for people on YouTube, we're going to be sending the survey also. You can have access to the pre-survey Now, so the survey is just to have a baseline idea about what you know about holistic medicine. What do you know about holistic medicine? It's just a baseline idea of what do you know about holistic medicine. So let's take our time. Let's fill in the survey. It will only take about 2 to 3 minutes of our time. Let's fill the survey. It is important. All right. So people on YouTube should now also have access to the survey. Please, if you don't have access to it, let me know so that we'll be able to help out. Wow, Stella says she's a student studying counseling psychology, and she's also a business entrepreneur. Awesome. She's a creator of Healthy Feast brand, a natural healthy drinks and pastry business. That is awesome. That is very industrious. Well done, Stella. Well done, well done. So I hope we're already seeing the survey. I hope we're already feeling it. We should be wrapping up with that right about now. Then we'll move to the next segment. If anyone is done filling it, you can just send a thumbs up or just send done in the comment section. If you are done filling it, you can just send done in the comment section. So maybe if one person is done, then we can move on. But if you're having difficulty, please just let us know so we can help. If you're having difficulty filling the survey, kindly let us know. If you're having difficulty, please let us know. Okay, so Dr. Tolu is supposed to come up first. I don't know. Is Deborah back? Oh, sorry, Deborah. I'm sure you've been trying to unmute. So you are now co-host again. Okay, yes, please. Deborah, over to you. We pray network will hear the word of the Lord tonight. Okay, so over to you, Deborah.
Thank you, ma. Okay. Please, are we done with the survey? If you are done with the survey, you can drop an emoji in the chat room. Are we done with the survey, please? Can drop a message in the chat room. Let us know if you are done with the survey. Okay. It's so good to meet you, Stella. Thank you. Thank you. Everyone else can drop a message in the chat room. Tell us your name. Tell us what you do. We want to know you. We want to know you. Okay. Okay, I'll be bringing up one of our speakers for tonight now. I'm bringing up one of our speakers for tonight now. So, um, I'll be reading a bio now. So let's prepare to learn. Let's prepare to really learn tonight. There is so much there for us tonight, honestly. Let's prepare get to really, really
Okay, it seems I'm no longer hearing Blessing. I'm sorry, Deborah. So let's move to bring up Dr. Tolu. But before I bring her up, Dr. Tolu is my friend, a very good friend of mine, and I've known her for a long time. Okay, maybe not so long, but it seems like we've known each other forever. So I'm going to be taking her bio very briefly. Please, am I audible? I hope you can hear me. I would appreciate our responses. So please let's know that we are following. Let it not be quiet, please and please, because this is a very relatable topic. Thank you, Peace. Thank you, Mrs. Hafsat. So Dr. Toluwalokpe Ogunjimi is a devoted daughter of God, deeply passionate about seeing souls saved and nurtured into spiritual maturity. She is a compassionate and purpose-driven medical doctor currently undergoing residency training in community medicine in OUTH. She believes in the healing of the whole man. She is a distinguished graduate of Babcock University, Babcock alumni in the house, where she graduated with several distinctions and was recognized as one of the best graduating students. Her time in medical school was marked not only by academic excellence, but also by a heart of service to God and leadership. Throughout her professional journey, Dr. Tulu has balanced the demands of modern medicine with a deep passion for evangelism, embodying the principle of holistic care that healing extends beyond the body to the soul and spirit. Her story serves as an inspiring testament to the impact one person can have when driven by professional dedication and spiritual conviction. Dr. Ogunjimi is also committed to mentoring and building the younger generation towards walking fully in God's plan for their lives. Ladies and gentlemen, please join me as I welcome Dr. Toluwalope Ogunjimi. Please, let's celebrate her. I want to see your emojis. I want to see your emojis in the comment section. I want to see your reactions. Let's welcome her. Let's welcome her. Let's welcome her. Welcome, Dr. Tolu. Welcome, 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 ma. So over to you now.
All right. So, good evening, Ma. Good evening, Dr. Onyade. Good evening, everyone. I believe, please, you can hear me clearly. Can you signify that you can hear me clearly? If you can hear me clearly. Yes. Thank you very much, please. All right. So, good evening, everyone, once again. It's a privilege to be able to be here today. Thank you so much, Dr. Onyade. Thank you so much. So I believe that for those of us that are just joining, a pre survey was sent earlier just to know what we know about faith and medicine. Just know what we know about faith and medicine. And from our introduction so far, I know that many of us have introduced ourselves. Some of us are medical students, some of us are nursing students. I know some of us may not be in the medical line, but one way or the other, health is paramount to everybody. It's not just because we're looking at this topic, not just from the perspective of a healthcare worker or a healthcare worker in training, right? But we are looking at it, even from the aspect of the patient side, because Many of us at some point, you may have a family member that needs to go to the hospital, a friend, a close one, and that you may be involved in their care directly or indirectly, whether you are a medical personnel or not. So we must remind ourselves again, faith, right? Faith and medicine, are they mutually exclusive? Permit me to use that word, or are they like two parallel lines that cannot meet, or they are combined in one way or the other? So now when we talk about our health, when we talk about our health, when many people hear health, when you hear healthy, when you think about health, one of the things that comes to mind is, oh, okay, I'm not running temperature, my body is fine, I'm doing well. So many times when we think about our health, what comes to our mind is how we are doing physically. So I'm not coughing, I don't have any symptom now, so I'm healthy. But then WHO defines health, as a state of complete well-being. Now, it talks about well-being. It addresses physical well-being. It addresses mental well-being. It also addresses emotional well-being, and not just the absence of disease, not just the absence of infirmity. So when we are talking about well-being, like I said earlier, many of us just think about physical well-being. We think about physical health. How am I doing? I'm fine. I don't have any physical symptoms. But we forget that health also looks at how is this person doing mentally? How is this person doing emotionally, right? In fact, at some point, they were also considering adding the spiritual side. We know that we live in a world where when it comes to spiritual matters, people will say, let them step aside. But then even if you check research, I'm checking about some studies, and scientifically, people have done studies that actually found out that spirituality actually plays a role, right, in the recovery of patients. So yes, there's the medical side. Yes, there's also the spiritual side. There are so many things that, that play out together, so many things that are intertwined together. So I'm just trying to say, like I was emphasizing earlier, that physical well-being is just one of the very many aspects of the health. It's not just the only thing. So when we think about this, it helps, right? It helps. Now, also in our generation, Gen Z, we see that a lot of people also have a lot of mental breakdown. I can go to work, be around my friend, and I'm smiling, I'm happy. That friend that you see that is smiling, that is happy, what happens? This person gets back home, this person is depressed. Their room is upside down. They can't even do anything because the person is not happy. The person is going through a state of depression. And meanwhile, everyone sees that person outside and that person is looking fine. That person is looking good. People are going through a lot of things mentally. Some people are so pressured, a lot of things, and they cannot, even medically, we have something we call psychosomatic disorders, where a person might be going through something psychologically, and then what happens? The person actually starts to see physical symptoms. And by the time the person does a lot of investigations and tests, you find out that they cannot really pinpoint to what exactly is wrong. And then the emotional aspect, right? We spoke about mental, we've spoken about mental, we've spoken about physical, but also emotional. We must understand that a lot of times when you see patients, even like on the ward, you realize that patients who have even supportive family members, they tend to do well. I want us to look at our Bibles, right? We're scientific students, and they were students of the word. So I want us to look at, I wrote a couple of scriptures down. 1 Thessalonians chapter 5, verse 23. It says, may your whole spirit, soul, and body be preserved blameless. Now, this is God telling us that, our spirit, our soul, and our body must be preserved blameless. Now, man, as we know, is a tripartite being. We have the spirit, we have the soul, we have the body, right? But sometimes, when we talk about health, we focus on what? On the body. We forget that there's a part of the soul, and then there's also the part of what? Of the spirit. Now, sometimes as we interact with patients, for me particularly, when I interact with patients, it's not just about, okay, the patient comes to meet you, oh, I have fever, I'm running temperature, I don't feel good, I feel dizzy. Sometimes you can just say, okay, this person is just feeling like it's okay. Go and do these investigations. When your results are out, what do? You come back. But a lot of times, you realize that patients want to talk. You realize that a patient may just tell you that, I've not even, I have some emotional, I've had patients open up to me. Oh, something like this is going on at home. Maybe my husband is not this, or my wife is not this. And you realize that it plays a role in what? In their well-being. It plays a role in what? In their well-being. So you realize that some patients, for example, will tell you that, doctor, if you don't give me injection, what happens? I'm not going to be healed. like I'm not going to feel better. I only work with injections. Also, patients will tell you that, I don't want injection, it's only tablets. Now, what happens? It's not as if your diagnosis is wrong. For example, you made a diagnosis of malaria, you did the test, and then it showed that the patient was actually what? It was malaria positive, the result. And then the patient is telling you that, it's only in injection, if you give me tablet, it would not work. That kind of thing, and that is the patient's mindset. That is what the patient thinks. And we need to know that the soul is made up of what? It's made up of the consciousness, it's made up of the will, it's made up of emotions. So you must consider that thing. So if the patient is telling you that I cannot do well with injections, I only want tablets, and you know that as a medical doctor, because now we must understand that faith does not rule out modern medicine. Because scientific research, medicine has evolved over time, right? We see that medicine keeps evolving. Even now, you have robotic medicine, telemedicine, where the patients somebody can be here and be doing an operation even at in a different site. So medicine is evolving. So we're not trying to rule out the place of modern medicine, right? We're not also trying to rule out the place of faith. So a patient comes to meet you, you have the options. Okay, I can actually give this patient is tolerating orally. I don't have to give injections. I can give oral. And the patient has already told you that, oh, I think I do better with orals. And then you give the patient orals. For example, now you give the patient, I think I had a patient like that maybe she wanted something else. So at the end of the day, she ended up coming back and saying, you see, doctor, I told you that it was not going to work. Now, it's not as if the treatment did not work. But as long as the mindset keeps thinking a thing is not going to work, it's not going to work, right? That is why the mind plays a role. And that's why as a healthcare practitioner, you cannot just say, I'm treating symptoms. You must treat the patient holistically, right? In family medicine, there's something they call patient-centered care. So you're not just coming with all the sense. You want to know about the family of the patient. Because for a patient now, you're telling the patient, oh, you need to do this investigation, 150,000, you need to do this. But meanwhile, this patient is still trying to source for funds. They don't even have money to eat. They don't even have family support. Sometimes you see, I had someone that was telling me something that she went to, like, she's a cancer patient and receiving chemotherapy, right? So she came to the hospital for a chemo session. Her husband was there, getting her everything she needed, getting her all the food, everything. And it was another patient that was just there. No family support. She was just always complaining, always feeling somehow, that kind of thing. And, she was just always talking to the other person and saying, see where your husband is taking care of you. And then it was obvious even on the mood, on the appearance of the patient, that she wasn't happy because she didn't have that emotional support. She didn't have that support of family. And you see that even statistically shows that I was reading, like I mentioned, a study on Burns patients, and it shows that Burns patients who are like, they have that support, that psychological support, it actually quickens their recovery. It actually helps their recovery. So we must understand something, that it's not just about treating the body. It's not just about, it's holistic medicine. You must consider the spirit of the patient. You must consider the soul of the patient. You must also consider the body. Sometimes some patients will come to you hopeless. They're like, doctor, I think I'm going to die. I don't think there's going to be anything that's going to happen. Even if you can just decide give medications, but the patient keeps thinking they are going to die. For that kind of situation, you must also meet the needs of the patient emotionally. You must also meet the needs of the patient. Ask questions. You want to know, why are you thinking like this? You want to know, how are you doing in your mind? How are your emotions doing? Some patients come to you, they cry, they are going through a lot of things. As a doctor, you cannot just say, oh, I'm busy, and all of that. No, we must understand that the spirit, the soul, the body, they are all connected. And to be able to effectively treat patients, right, we must make sure that we are addressing all of the needs. Now, like I said earlier, I know many of us may not be in the medical line. So what role do we have to play even as patients? And it's also important, like I said, you may have friends, you may have family members or other people that are not feeling well. We must understand that it's not just, okay, my friend is not feeling well, what can I buy for the person? Oh, let me get the person the drug. How are you there for the person emotionally? What are you doing for the patient's psychological well-being? What are you doing for this person? So honestly, in my medical practice, I've seen that you cannot just take out the physical side. You cannot just take out the scientific part. And even as a medical doctor, a lot of times, patients are very vulnerable. And so it's not just, let me just do what I need to do. And you must understand that this is a soul that needs a touch. This is a soul that God wants to even use you to be an extension to the hands of patients. Patients sometimes come to meet you clueless. Some of them are literally like, doctor, tell me what to do. But if you are just considering just the, a patient can come and tell you that, I have 5 children, I'm pregnant. Doctor, what do you think I should do? You may just think that, oh, okay, the patient is telling they want to abort their child. Well, Nigeria doesn't really support that, but in a foreign country, but then you understand that you can just say medically, you are telling the patient to abort their child. But then, what about the emotional trauma the patient will have to face, or what goes on in their spirit man? The Bible was speaking in 3 John 1, 2. It says, Beloved, I pray that you may prosper in all things and be in health, even as your soul prospers. So even God understands that your body needs to prosper, but even much more, your soul also needs to prosper. It says that a merry heart doeth good like medicine. So if the Bible is saying a merry heart, a joyful heart, looking at how a person is doing emotionally, that it doeth good like medicine, comparing it to physical medicine, then you understand that the mind plays a role, the spirit plays a role in holistic medicine. So we would also, with time, also get to hear more things through our questions and through our interactions. So thank you very much.
Thank you so much, Dr. Tolu. Thank you so much. That was a very wholesome session. I love the way you took us. It was like you were taking us on a journey, and it was awesome. It was awesome. Thank you so much. You actually spoke like a correct, like a correct community health resident. Really, you took us from the roots of what health is exactly, and you brought us into whole holistic medicine. Thank you so much. Is the world back? Is the network okay? Okay, so
Yes,
over to
ma'am.
you,
Yeah.
Deborah.
Thank you so much, ma. Thank you, ma. Are you there? Are you there? Can you hear me?
Yes, I can hear you. I believe she can hear you too.
Can you hear me? Okay, okay. Thank you so much. Thank you so much, Dr. Tolu. Thank you. Thank you. It was such an amazing session. Thank you so much, ma. Thank you. Thank you so much, ma. So we'll be bringing up Dr.
Okay, sorry. Can you still hear her, or is it just me? Just can you still hear her? Okay. Thank you for the response. So I'm going to be coming up now. She was supposed to take my bio. It will be strange for me to be reading my bio, but we move. Okay, so I'm going to read it like a third person. So it's not me, Dr. Onyedika Onishi. Okay, so Dr. Kaunishi Oyade is a compassionate medical doctor with a strong passion for preventive medicine and public health. A recipient of the President's NYSC Honors Award in 2025, she has over 4 years of experience empowering individuals and communities to take charge of their well-being. A graduate of the Lagos State University College of Medicine, she currently works in the obstetrics and gynecology department at Alimosho General Hospital, Lagos. Her work in tertiary hospitals deepened her commitment to disease prevention and health education. Dr. Kaonishe pioneered the first preventive medicine clinic in Jigawa State at Duse General Hospital, organized community outreaches and developed a preventive medicine manual to sustain the clinic's impact. Through webinars, health talks, and outreach programs, she continues to inspire healthier living. She's a dedicated public health advocate, a caring physician, and a proud child of God. With joy and love, let's welcome Dr. Kawanishi Unyante in person of moi. Okay. So thank you. Please, am I still audible? Can you hear me? Thank you, everyone. Thank you, everyone. Sounds strange reading my bio, but I need to get used to it. All right, so I'm going to be sharing my screen. I just have a very short slide to work with. Okay. Please let me know if you can see my screen. I'd appreciate your responses. Okay, can you see my screen, please? Can just send a thumbs up. Okay, thank you, peace. So my subtopic, the subtopic I'll be taking is where faith and medicine intersect, navigating complex decisions. So there are many times that, like Dr. Tolu have said, she defined what health is for us. And we need to understand that health does not end in physical. There is a physical component, there is a mental component, there's an emotional component, there's a social component of health. So health does not end in only physical. Now, it would be a mistake for a patient or any caregiver to address health as only physical. So even when you are seeing a patient, when you see someone coming to you, you are not supposed to address only the physical aspect. Now, when we now put that into consideration, there are times where faith and medicine can collide, when some complex decisions need to be taken. So this slide, we're going to be talking about introduction. We're going to have an interactive reflection. We'll talk about case studies like examples. The key challenges when it comes to this, our takeaways, then would also engage ourselves. So as a way of introduction, faith and medicine often meet at critical decision points. Please, can you see the screen? Okay, I think it might be better now. Okay, so faith and medicine often meet at critical decision points. This moment requires sensitivity, respect, and collaboration of both parties. Now, many times these points are very critical because you have someone coming from a long line of tradition where they are not used to doing some kind of things. And this is you that have spent about 7 years in medical school plus house job, and you know what you have been trained to do. However, somebody is coming and telling you that my tradition does not permit this. How do you go about it? Patients often balance deeply held spiritual they often balance deeply held spiritual beliefs with medical recommendation. It is possible. However, this interaction can feel like standing at crossroads, choosing between what feels spiritually right and what is medically advised. Now, I think earlier before, Dr. Tolu talked about a woman, that has 5 children, and she's pregnant again and having to, go across that borders. In this part of the world, it's not even legalized. However, some people, even their religion does not even permit any voluntary termination of pregnancy. So recognizing this tension helps healthcare providers to approach decisions with empathy and respect. Those are two things I need us to take note of, both as a caregiver and even as a patient. So when we look at this interactive reflection, how would you balance medical advice with personal or spiritual beliefs in a life-changing decision? Now, I would really love to hear from us. If it were you personally, how would you balance it? Or how have you been balancing your own personal beliefs with medical advice? So I would like to share a story at this point. Okay, let's talk about this. Have you ever faced a health decision influenced by your beliefs or values? How did you navigate it? Did you lean more on faith, medicine, or a blend of both? Now you can share, please. Let's do well to share. I am waiting to hear from us. We can share. So I'll just like to share, I think, 1 or 2 stories. Some time ago, I was in the north serving, and there was a particular person that came to me, and his complaint and everything made me arrive at the diagnosis of malaria. It was a to an extent, let's say, severe kind of malaria. So my approach was to go with injection. Like approach to have him like an intramuscular injection. Now, this guy then told me that he cannot collect intramuscular injection. Then I asked him why. He said he is from a tribe in the north where they don't use iron. Like, that was the first time in my life I've ever heard that kind of thing. They don't use iron. So they don't use knives. They don't use anything that has to do with iron, like syringes or sutures or something that is iron that will enter their body. He said they don't do any of those kind of things. He said even as he is gone, that he came from a far distance and he trekked all the way from his house to school, because I used to work in a university healthcare, in a university PHC. So he said he trekked from his house to school, that he cannot take any vehicle that is made of iron. So this kind of person would not use knife, would not use car, would not use bike. I said, what if you want to buy a car? He told me that he will never buy a car. I've never been so shocked in my life. That was one of the culture shocks I had when I was in that part of the world. It was a massive shock for me. Now, imagine me being a doctor. I'm like, oh no, this is what you need. And I insist on giving him the injection because of his belief. Something might have gone wrong. Even if it is not about that injection, it might just be something else because of his belief. Then I shared this particular thing with some people, and people are like, yes, so it's true. Yes, it's true that even if they are involved in an accident or something, that they will refuse to be sutured. That you can give them medications, you can give them tablets, but no injection. Nothing about iron must enter their body, and all of those things. So that was the first time I was hearing that kind of thing. Now, how do we go across this? How do we move forward from here? So I've talked about the scenario. So we have different kind of scenarios. Sometimes a doctor is treating a patient with cancer and the patient is refusing chemotherapy, saying, oh, it is because of their beliefs, that they believe that God is going to heal them. Now, in its sense, God heals. God is a healer. But you cannot abandon one aspect of his wisdom, because it is God that gave wisdom for modern medicine. You cannot decide to abandon that aspect and say, oh no, God is a healer, God is a healer, and you will decide not to do anything about it. That would not be balanced. So the key point at the end of the day is to respect faith while ensuring informed consent and offering supportive care. Now, what are the guiding principles concerning this? When you get to that junction, whether you are on the side of the patient or you are the medical practitioner, what are the guiding principles? Number one, respect. Now, even if it is not your belief, even if it is not something that you have heard about, like that iron story that I shared, I'm sure that some of us here, we've never even heard that kind of thing. You still need to respect that person's perspective. So acknowledge that faith is central to identity, just as medicine is central to health. Faith is central to identity. So another thing you need to do is to dialogue, create a safe space for patients, for families, and providers to openly discuss their concerns. I've realized that if a patient does not understand what you are helping them through, they would not be able to comply with those instructions of yours when they leave your presence. So it's not just about giving instructions or something, but talking to them, explaining to them, let them understand, and also create a safe space such that they can also air their concerns. Number three, integration. Explore alternatives or compromises that align with both values and health needs, e.g., faith sensitive treatment plans. I think I'll give an example for this one. Um, Very recently, a religious sect, brought out a news that their members can now start taking autologous blood transfusion. That means that you can donate blood yourself, and then maybe a few days later or whatsoever, you take the blood. Honestly, personally, I don't think that thing will work. However, being able to integrate or explore other alternatives is when you have such a patient that refuses to take blood transfusion because of their religion. you are able to explain to them properly, yes, you need this blood. However, if you insist on not taking it, of course, you have to put your signature down. Some of them, they have these identification cards that affirms that, oh, they can't take blood, and all of those things. However, there are some other components, there are some other fluids that they can take. It is not blood, but it can mimic what blood will do in the body, something like that. So for those kind of people, you can explore alternatives, just integrate some of those other things while explaining to them explicitly that this is what you need actually. But since you don't want it, we cannot force you. Empathy is also very important. Recognize that decisions are not just clinical, they are deeply personal and spiritual. So you have to show empathy. I think Dr. Tolu mentioned earlier, you don't just see a patient and just, go away and just move on like that. Some of them, they really need your empathy. They need to see you. They need you to understand what they are going through. Now, what are the key challenges in carrying these things out? Balancing autonomy and medical responsibility. Autonomy will say that, oh, a patient can decide what they want and what they don't want. However, your medical responsibility is telling you this is the correct thing to do. So somehow you have to balance it. Two, addressing cultural and spiritual diversity. Some of us, we have not, of course, it's not even some of us, all of us, we have not been to every part of the world. So there are some cultural realms you get to that you don't even know the kind of cultures that they deal with there. You don't understand it, like it is incomprehensible to you. However, be open to learning, be open to understanding their culture, even as you are there being their doctor or their caregiver or even living around them. Building trust through dialogue. It is very easy to build trust through dialogue. Allow them trust you. Create safe spaces. Be empathetic. Make them understand. Understand what they are going through. Now, what are the key takeaways in this session? Holistic medicine requires dialogue between patients and health givers. Very, very important. Empathy for spiritual convictions. You need to understand where they are coming from. Though there are extremes, I know there might be extremes. I remember some cases, a particular woman that had breast cancer. When she came in the first place, I think she just had like type 2 and all of those things. And the plan was to do radiotherapy, chemotherapy. Then when it reduces, they will do surgery and all of those things. But the woman now went away. She went for a long time. By the time she was coming back, she was already in stage 4. And then when she came, she was like, oh, she has been in her religious facility that they told her to stay there, that they've been helping her, they've been praying for her, and all of those things. But the thing has been getting worse, and the stage 2 has already become stage 4. So there are some extremes to these things. Yes, you cannot force them, but you can make them understand. You can explain to them, encourage them, be empathetic. Now, shared decision making, honoring both faith and science is also very important for holistic care. In conclusion, faith and medicine are not opposites, but partners in healing. Together, they support the whole person, body, mind, and spirit. And this part says in 1 Thessalonians 5:23. And may the very God of peace sanctify us wholly, and we pray our own spirits, souls, and bodies be preserved blameless unto the coming of our Lord Jesus Christ. So even God is concerned about your whole body, your spirit, your soul. God is concerned about it. So even as a physician, as a patient, even as you yourself, you also should be concerned about your spirit. You should be concerned about your soul. You should be concerned about your body. So that means for you to experience wholeness, take note of those things. So it's not just headache. Sometimes it might just be that you're stressed about something. It's not just abdominal pain. Sometimes it might just be that you're hungry. It's not just so some of these things you just have to look at yourself as a whole person. You're not just body, your spirit, and your soul. So in conclusion, medicine is not an enemy, but a partner in preserving life. Thank you, everybody. Thank you so much. Thank you so much. I hope that I've been audible. I hope we heard me. Okay, so that's a wrap from me. Okay, thank you, thank you, thank you, thank you. So right now we're going to go into the question and answer session. We're not going to be taking so much time. So if you have questions, kindly drop your questions in the comment section as we go on.
Thank you
Deborah, are
so
you there?
much.
Okay.
Thank Okay. Thank, yes, my thank you so much, ma. Thank you so much. Thank you so much for this session. So it was really mind blowing, I must say. Okay. Um, I have two questions for our speakers tonight. I'll be starting with Dr. Tolu. Dr. Tolu, are you there? Dr. Tolu, please, are you there? Okay. Okay, let me start with Dr. Onyi.
Okay,
I
I
want to
think
ask
Dr.
this
Tolu is
question.
here. Dr.
What
Tolu is
role
here.
does spirituality play in patient recovery?
Okay, Dr. Tolu, can you hear me? It seems she was not hearing you. Oh, okay, 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 okay. Sorry. Sorry.
Well-being,
Okay,
All right, thank you
especially
very
in
much. I was trying to
chronic
unmute.
illness
okay. I
management.
think um Deborah's mic is lagging, so it's taking a long time for her to see that you are here. So
I think she was
Deborah,
asking what role does spirituality play. I didn't get the remaining part of the question.
okay. Deborah, can you hear me?
Dr. Tolu, can you hear me
Hello.
now?
Yes, we can hear you, Deborah. Think
Deborah,
network.
can you hear me?
What can you hear me now?
Yes, we can hear you.
Can you hear me now?
Yes.
Can you hear you? Can you hear me?
Yes, we can.
Yes, we can hear you.
Network.
Okay. Can you hear me now? Okay.
Yes, we
What
can.
role does spirituality play in and overall well-being, especially in chronic illness management?
Okay. Please, can you come again with
Should
the
I come
question?
again?
Yes,
Yes,
please.
I can hear you.
Mm.
Should I come again?
Yes, please. You can come again, please.
Okay. What role does spirituality play in patient recovery and overall well-being? Especially, okay. What role does spirituality play in patient recovery and overall
Okay. What role does spirituality play
well-being,
in patient
especially
well-being?
chronic illness
I think the
management?
thing is still breaking. Let
Okay.
me take the question from here.
Okay, ma'am.
Let me take the question from here then.
Should I come again?
Um, Deborah,
Okay.
just hold on. Let
Okay.
me take
What
the
role
question.
does spirituality
Okay, so she was saying, what role does spirituality play in patient recovery and overall well-being, especially in chronic illness management? Did you get that?
Yes, yes, yes.
Oh,
Okay, so what role does spirituality play in the well-being of a patient, especially in chronic conditions, right? Yes.
yes, yes.
So, like we mentioned, there's a part of modern medicine, there's a part of spirituality. On like you also shared with us, there are sometimes where it may look like, you know, they are on opposite ends, and then sometimes it looks like there are times where they align. Now we need to remind ourselves, right, that like we said, like I started earlier by saying health is not just how a person is doing physically, but how a person is doing also mentally and emotionally. Now, when you look at situations where patients are having chronic diseases, it could be cancer, it could be hypertension, it could be many things. Many times, patients may get discouraged. There are many times that a patient, for example, now that is hypertensive, has to be using drugs every day. A patient who is diabetic has to be using drugs every day. A patient who is having cancer, it may look like this is stage 4. And medically, the person has to go through. We know how cancer can be, for example, using cancer as a case study. A person has to go through probably cycles of chemotherapy where the person has side effects that really waste their body down. The financial part of it, all of those things can get the person depressed. So if the person is just looking at how they are medically, oh, the person has cancer, they have to go through a lot of things, and the person is just thinking about the medical side. Most times, the patient, a lot of times, it's even the weight of the sadness and how they are feeling emotionally. Sometimes that even worsens their medical condition. But then
mm,
spirituality to it, you know that what when there is life, there is hope. You know that, let me give an example. Philippians 4:6, one of my favorite verses, it says, be anxious for nothing. Do not worry about anything. The person can have confidence in God. That doesn't mean, no. Now, there are some people that will tell you, oh, I have faith in God, so I'm not going to use medication. No. Well, everyone's, people will tell you they have clear, people will tell you
I
that
know,
they
right?
have clear, they have
Yeah,
clear instructions from God. Well, if you feel like
yeah.
God is telling you, but one thing I tell patients, I tell them, I say, see, I tell my patients, I said, I'm a Christian. I still told the patient today, I said, I'm a Christian. I said, so I am telling you, do this, do this, do this. So I always tell people, I say, okay, if you, I believe in the supernatural powers of God, I believe in the miraculous, right? But I told them, I said, see, even if you have faith that God is telling you to stop using your medicine, at least you should check your BP, and your BP should be low. You should check your sugar, and your sugar should be low. You can't be saying
Yeah.
God said you should stop using medications, and you are checking your BP, you are saying your BP is
And
200 over
it's
200. You can't deny that. Right? Faith is not you denying that there is a problem. You actually admit that there is a problem, but you know
yeah.
that God is going to solve. So you are not oblivious or you act ignorant that, oh, that it's not there. No. So obviously, like I said, spirituality plays a role. So in patients that have chronic disease, that doesn't mean that, oh, because you're spiritual, you're going to stop using your medication. But there's a joy that you have, right? Knowing that God is with you. There's a joy that you have, that knowing that no matter what, you're going to be fine. There's a joy that knowing that even if I have to take medications every day, there's that joy. Your joy is not that, it's time for medications. You feel sad, you feel unhappy. No, because your joy is in greater things.
Mm,
Right? There's a kind of, if you feel that has, that no matter what you are going through, God is with you. So let me
mhm.
just, yes, stop there. Thank
Thank
you
you
very
so much. Thank you so much, Dr. Tulu. That reminds me, or like it reminded me of a patient I had that came into my office and she was like, "Oh, doctor." As in, she told me she knew herself that she had uterine myoma, like fibroid, and she was like, "Oh, that the instruction from God is that she should not do surgery. One thing, one thing." After so much, questioning and everything, I realized that she had a fear because when she said God told her not to do surgery, that the thing will just go. So I said, okay, so which word did God give you? Because faith comes by hearing and hearing by the word of God. So even if God is speaking to you, you should have a word that you are holding on to, that, oh, God told me this. But you are coming, you're saying God said, but you don't have any word. So I realized that it was a fear of surgery that was deterring her from getting the myomectomy, like removal of fibroid that she needs. So this thing is a really serious matter. Thank you so much, Dr. Tulu. So Peace Shofayo has a question. He says, what is the most advisable option in a case where you are aware of a person's religious or cultural beliefs, but the patient isn't in a position to actually speak or consent to the medical procedure, and there is no relative present? Do you still go on to make the best decision for the patient as the caregiver, or do you regard the patient's religious beliefs? So, Shofaya is asking this question. I think I'm going to go on to address this particular question, and then maybe Dr. Tolu can also add to it. So, the most advisable option actually in this case is to go on with the medical care. But in most cases, in this part of the world, even if there are no relative present, there might be ways that you can get a relative on the call to get a verbal consent. Now, a verbal consent is better than no consent at all. So if you can get a verbal consent to go ahead with, treating the patient as required, then that is fine. That is fine. Now, if you are looking at this in a way of maybe somebody that does not take blood, the blood part, and the person needs blood. Maybe there was an RTA, like a road traffic accident, and the person needs to be transfused, and you are still trying to get in touch and you are not able to get in touch. At the end of the day, what you should do is to do no harm to the patient. That whatever decision you are going to make, it is going to benefit the patient at the end of the day. And of course, before you go ahead with that, you also have to carry people along, carry your colleagues along, especially your senior colleagues along in such a situation. Dr. Tolu, do you have something to add to this question?
All right, thank you very much, ma. So, like in this situation, you said the question you asked, Peace, you mentioned that the patient isn't in a position to actually speak, right, or give consent. So this could be in a situation and there's no relative present. So this would be in a situation where the patient is in coma, but the patient is not, how do I put it now? Maybe the patient has some mental problems and all of that. They are not in the right state of mind. So in that kind of situation, like Dr. Yadi already mentioned, you must think about not doing any harm. So there are protocols, there are guidelines, there are ways that of managing a particular patient. So in that kind of situation, you must understand that you are doing no harm to the patient. So in as much as a lot of times you are Christians, for example, now there are times where I interact with a lot of young people. Now, as a Christian, personally, I don't believe in having sex before marriage, right? But then you interact with what's it called? You interact with clients, right? Particularly young people, and they're telling you they are sexually active. You must be careful such that you are not imposing your, how do I put it, your beliefs on them. But there is a way you can also pass across your own message. Because at the end of the day, they will come and tell you, I met a doctor, she did not tell me this, she did not tell me that, she was just sounding judgmental, telling me what am I doing, so am I doing that. There is a kind of wisdom I trust God for in how to be able to tell them that, see, you know, this is what I think you should not do. You should not be having premaritals. And I try to emphasize on some of the dangers and harms and all of that and all of that. But I will not now be a medical professional if I am not talking to them about the other things they're supposed to do. But I relay more emphasis on what? On abstinence. I do. So in this kind of situation, you must also look at it in a patient that is unconscious. You must be careful, because at the end of the day, if they take you to court, they would, if whatever you did, even though it was according to your beliefs right, if medically it wasn't right, in that kind of situation, you can lose your license for it. So thank you very much.
Thank you very much, Dr. Tolu. So this second question says, how can individuals balance personal beliefs with evidence-based medical advice while making health decisions? So how can individuals balance personal beliefs with evidence-based medical advice while making health decisions? So I think personally, any individual that has personal beliefs about something, the beliefs is always from a particular thing or from a particular person or from the scripture in our own case as Christians. Now there is always a balance because God is not an author of confusion. The same God that tells you that, oh, he's able to heal you, he's able to do exceedingly and all of those things, can still be the same one that is telling you about eating healthy and taking your medications. So most of the times, if you really say you are somebody that has faith in quotes, then your faith should be in a God. Your faith should be in his word. Your faith should not be derived from your fear. So your faith should be based on his word. So as much as, yes, there are evidence-based advice that your doctor has given you and all of those things, God has also given you his word that is faith-based. And most of the times, if you sit down and look at it, it can be balanced. They can coexist. They are not like Dr. Tolu said in quotes, not mutually exclusive. They can coexist. Faith can coexist with medicine. Faith can always coexist with medicine. So even while making health decisions, your personal beliefs should not be against what the doctor is saying, or should not antagonize what the doctor is saying. Some people even come to the hospital just so that they can come and argue. I remember some people, they'll come and you check their blood pressure is shooting up to 200 and something, and then they tell you that's how my body is. I've not been sleeping well. Like, even if you have not been sleeping well, it is not supposed to get to this extent. And you keep explaining to them, but they are still insisting just because they are in denial. They don't want to accept that, okay, this thing is actually wrong. I think Dr. Tolu mentioned something that even if you have an instruction from God, like, there's always evidence. When it is with God, there is always evidence. There will be evidence. Something I like about my spiritual father, Apostle Lazarus, is a medical person, and yes, is also a man of God. So even when after healing services and all of those things, he always gives the instructions that you should go and check. Go back and run your tests. Go back and run the investigations. Go back and repeat the scan. Let there be a proof that what was there before is no longer there again. Not that, oh, you have elevated BP and it has been getting high. You prayed, and the thing is still getting high, and you're still refusing to take your medications. Then that is a non-balanced way to go about that. So I think we understand that aspect very well. So Dr. Tolu, I'll be asking you one more question. Please, if you have any questions, you can drop it in the comment section. So this question says that, okay, are there examples of successful collaborations between medical professionals and faith leaders in patient care? Are there examples of successful collaborations between medical professionals and faith leaders in patient care?
Well, the thing is, how do I put it now? There'll be many examples, right? Because the thing is, in this part of the world where we are in, I would say a lot of people are religious, not spiritual, right? We see many, I have had cases of, I think I saw patients like maybe it was a set of twins. I can't remember, babies where the mother went to deliver in the church, right? And then these babies were premature. There was something they had jaundice, and then obviously neonates now. You cannot just take them to any hospital. You have to be going up and down. So definitely, I think one of the things that will help is spiritual leaders, like you mentioned, Apostle Femi Lazarus, like knowing that even when even this, that's something that AGS also does, Apostle Joshua Selman. Even when they come out for testimony, you tell the very medical people, please verify. Please verify. So I feel like spiritual leaders should play a role in telling people that, like you mentioned, the Bible was even saying that, yes, bodily exercise, it actually profits more, right? The Bible even supports, cleanliness, supports exercise, supports this. So there's a point where I think that faith leaders, pastors, people in spiritual authority should be able to tell people that some things are important, some basic things, rest, sleep, hydration, taking a lot of water, going to what's it called? Going to the hospitals for checkup. Those things are normal because a lot of times, let's be very real, many people, spiritual leaders have they have a lot of influence on us. They have a lot of influence on us. So I believe that spiritual leaders should play their part in encouraging people and bringing that awareness to congregation members, and also medical people also should also know that there's a part of also considering your patient's faith, considering how your patient is doing. So there are many examples of the two coming together. There are many, many, many examples, right? There are many examples. I know someone personally where the person had a terminal illness, cancer, well, and it was detected on time, right? Obviously at that point, the person was praying and praying that, oh, God, heal me now, like as per the kind of healing that I don't need to go for any operation. Let me go back. And then they say there is nothing. But then what the Lord said was that I was going to heal you through medicine. And then what the Lord said that it is even by my grace and power that they were able to detect what was wrong. Because to be honest, you've had situations where patients spent series of money on several kinds of tests, and then not like they can't find out what is wrong, but even when the patient starts medications, what happens? You cannot really see any tangible, significant improvement. But then God was telling this person that it is even by my grace and help that they were able to diagnose what was wrong. And it's by my grace that you have to go through chemo, and that you even went through surgery and you are fine. And now you are what? You are now even certified cancer free. Now the person could have thought that, but I prayed to God to heal me, to take me, take away this cancer. I went back and they still said I have cancer, meaning God does not exist. But God was trying to tell you that even in this medical practice, the fact that they could find what was wrong and there's a solution and you're even responding to the treatment is actually by my hand. So yeah, so this is where I'll stop.
Thank you so much, Dr. Tolu. Thank you so much. We are really, really grateful, and it's such a pleasure to have you here. Thank you so much. Thank you. Love you. Okay, so let's celebrate Dr. Tolu once more. Let's celebrate her. Let's celebrate her. Thank you so much. Okay, so I just sent the link to the post survey to the group. Please let's access the link and fill in the survey. Now we know about what holistic care is. I don't know. I think there are some medical students here, and some of you might be CMDA doctors or CMDA students. If you are not CMDA students, you better go and join CMDA. So you understand what holistic care is, and this is not just in the aspect of what you hear, but what you practice daily. What you practice daily. So we can all fill in the post survey. If you have questions, comments, you can drop them. And if you have experiences that you just want to talk about in concerning this topic, you can just signify by showing your hands.
Okay, so I'd like to share something I just remembered. So
Okay,
I
yes.
remember that there was a time that even as a medical doctor, oh God, the call is coming in. So even as a medical doctor, even as I treat patients, I always have that consciousness at the back of my mind that what would you want me to do, God? You know how even for medical practice, right? There are, how do I put it now? For example, if you want to treat a patient that has malaria, there are several drugs you can use. There's no one size fits all. You can use different types of ACTs, right?
Yes,
So
yes.
sometimes yes, that's the medical. So that's what I'm trying to say, that you being spiritual does not mean that you will not give the patient the best care. You will, but when you have several options that seem to be on the same, and you are presenting to your patient like, oh, you're the doctor, make the decision. I remember I had a patient that a while ago, a young person, and then she was complaining to me about some skin, some complaint. She had some complaint, and then I was just like, okay, what do I prescribe? What do you think I can prescribe out of these options of medication? And then the Lord said, oh yeah, I'll give her this. And I remember the next time I saw the lady, she said, that do I know that the drug I gave her work? That what drug did in my head, I had to go back to the EMR and say, I don't remember what I prescribed for this patient. I had to go back to the system to check that what did I prescribe? And I realized that I didn't prescribe anything extra, like anything. I don't know if you understand, that seemed
Yeah.
so, because she said she had used several drugs and what I prescribed were just basic things, not really anything outside of the box. And I just saw that even as a medical doctor, having that consciousness, because when you have many options, that it's not as if one outweighs the other and you're wondering what to do. Just having that consciousness that God knows everything and He can actually tell you to do this and then you can actually be able to do it well, and then you see that there's actually a better outcome for your patient. And then a lot of times I even ask patients even before I pray with them, because you must understand that they have the right to decline. Can I pray with you? And many of them would say yes. I don't think I've even had a patient say no. Many of them will actually say yes, because they're actually very, very desperate. They know that what they need is actually more than what you can actually offer them as a medical doctor. Thank you.
Yes. Thank you so much. Thank you so much. I love the way you're addressing this thing, because this is actually what is happening every day. Thank you so much. I really appreciate you. Thank you so much. Thank you so much. Okay, we have come to the end of this webinar. You can access the post survey on the group. Kindly fill in the post survey if you have not done so. You can see it on the group. Please fill it in. And for those that registered, we'll be sending the recorded sections to our emails. Thank you everyone for being a part of this webinar. I really appreciate you. And don't forget your take homes. A man is made up of the entire spirit, soul, and body. And you personally, individually, your relatives, your friends, anyone around you that is getting sick or something that is reoccurring every time, you need to understand that it goes beyond the body. It goes beyond the body. It goes to the spirit, it goes to the soul, it goes to the body. So everything is involved. And as a caregiver, as a nurse, as a doctor, as a medical student, you need to understand that as you attend to patients, as you attend to clients, you are seeing them holistically. Don't just leave one aspect. Sometimes people just, most of my patients, especially the pregnant patient that I have, some of them just need some form of, counseling, some guidance. And especially the first time mothers, they're scared of this, scared of that. And you just realize that they don't even need medication. All they need is for you to allay their anxieties, for you to explain what is happening to them, and, all of those things. So address every person you come across, spirit, soul, and body. Even if it is your neighbor, understand that, oh, they are holistic. You need to attend to them holistically. And I pray God will continue to help and strengthen us in Jesus' name. Thank you so much, everybody, once again. Thank you so much. And this is the end of this webinar. See you again next